because it's the engagement officer that has the numbers, but they should start joining now. I've just allowed them.
Historically, how many do you normally have from
it depends. I did one webinar this year, and that was one on preparation for Oreo, and that was quite very engaging. We had over 200 people, so
Wow.
that was very good.
Oh, that's good.
So we'll see. Yeah, hopefully many more.
Yeah, that's fine. As I said, it's basically looking at it from a Day-Lewis perspective, really, and just giving our own experience as a company, what we have to offer. And at least it's always nice for people to hear it from the people who are actually doing it, rather than someone like myself, even though I've been through the process myself. But it's always nice to speak to people who've recently graduated or who are currently going through it. And who knows, maybe you would probably join us too.
Yeah, maybe.
You never know. You never know. Okay, so it's cool. It looks like people are joining us already now. So should we just give them probably about when do you think? You just let me know when you think it's appropriate. We're more than happy to wait if that's okay.
Yeah, we can give it a few minutes and then make a start.
Yeah, that's fine. I'm hoping that people, because obviously it's around 7 o'clock, maybe people are going to be a bit of a while to join, but we'll see. We can wait for another 5 minutes or so. We will have our company director, one of the directors of Day-Lewis, Rupa Patel. She too will be joining probably later on, and probably towards the end. She will just probably say a few things if she's still on anyway, just to show our appreciation for you for hosting us, because we really are grateful for that.
No, I'm definitely really excited. I've got a fun story for you, Ade, actually, with your travel clinic that you said you ran. It reminded me of a few weeks ago. So my pharmacy is really close to a local primary school. So the head teacher rang and she was like, is it okay for my teachers and all my staff come down on a certain day to get vaccinated? And I thought, yeah, that's absolutely fine. They said, just give us a day, we'll be there. There's going to be about, like 30, 40 of us. And I was like, okay, well, that's quite busy. So I said, yeah, come down next Tuesday. And me and my colleague, Wendy, who's a non-pharmacist vaccinator. Yeah, we'll do everyone. That's absolutely fine. And then that week, Wendy caught COVID. So it was just literally me just queues and queues of teachers just coming in. It was a fun one. Definitely
it is
that day.
And that's the I think for me the highest number of jabs I've done a day is probably over 50 or so, I think. If not, something like that, bearing in mind how busy it can be. But once you get into the rhythm of things, it's quite it's much more easier.
Yeah, it's hard to not just sound like an automated robot saying the same thing over and over and over again. Yeah,
I know, but it's fun, and I think that's part and parcel of what it is to pharmacists. It's some of these things. And bearing in mind that many years ago, probably about 15 years ago, GPs did not want community pharmacists to do flu vaccinations.
Yeah,
they were literally livid when it was first suggested that pharmacists were going to be doing vaccination. They were literally saying, no way, we could not allow them to do this. They're going to end up killing patients. They're going to do this, they're going to do that. It was unbelievable. It was a real fight, a real battle to get pharmacists at the time to do vaccinations. And here we are now doing. In fact, as I wouldn't be surprised that in another maybe, I don't know, 2, 3, or 4 years' time, flu vaccinations will be done predominantly through pharmacies rather than through surgeries. I would not be surprised at all. And then maybe immunizations will be done in the GP practices, but flu vaccinations, COVID vaccinations will be done in pharmacies.
I mean, that's all I ever hear is people coming in and saying, oh, this is much better than going to the GPs, That's what every single person say. So yeah, I'm not surprised that it will head in that direction. I'm surprised now that you think that we're not doing more than GPs, especially knowing how many Day-Lewis have done in total. Yeah,
absolutely. So it's exciting times, definitely. And by the time our audience and also newly qualified pharmacists in another few years' time, we probably won't be doing any dispensing, to be honest. That will be down to technicians and dispensers, and you guys are just going to be focusing on services and being an independent prescriber. Again, that also helps. So there's a lot of things that can actually be done by you guys, which is just brilliant. Oh, I seem to come on twice here on the, I'm not quite sure why, or maybe someone else is coming through. I've got my name coming up twice.
I think it's the same thing that happened with
it's Rupert.
Darcy.
Yeah, it's Rupert.
Yeah.
Hello, Rupert. Can you hear me? Okay, good.
I can hear
Do you
you.
want to? Yes. Could you please just change your name because it's coming up as my name?
Yeah, sure. I don't know how to do that. Yeah, but I can do.
I think.
I don't know if I'm using your link.
Yeah, I know. That's probably why it's come up as my name. So I don't want the audience to be confused and thinking,
It
okay.
doesn't let me do that. It doesn't let me do that because I'm using your link.
Okay, let me see if I think let me see if there's a way which you can do that. Change name.
There must be a way because Darcy managed.
Yeah.
Can you help?
Let me log back out again. I'll log back out again.
Yeah. That's
How is it you change your name, Darcy?
Oh, you right click on the name and then click rename.
Okay, right.
Okay.
So 2 steps.
Okay, she's
Yeah.
gone. Okay.
Yeah.
Anyway.
Well, we can try again.
Yeah, she's gone. I'll just be a second. Let me just.
Okay, shall we make a start now?
Yes, we can make a start if you are happy for us to start.
Yeah.
Let me just do that. Okay. I'm just going to just do that and just make sure it's just so I can see I don't get distracted. All right, just give me a second. Okay. Right, good evening, everyone, and welcome to this Day-Lewis BPSA webinar. It's a pleasure to be with you, and hopefully we will be having more of our colleagues and your colleagues to join us on this particular webinar. The whole idea of this webinar is to just go through some things about community pharmacy and in particular Day-Lewis, and we'll be discussing this with some panel members. My name is Adenola Olaide. I'm the Foundation Trainee Manager, and my colleague, Dr. Caroline Parkhurst, who helped collate the slides together. She's not here with us today, but she's part and parcel of the team. So what's the agenda going to look like for today? It's literally, first of all, we're going to do some intros and housekeeping. And once we do that, we will do that for about 20 minutes, for about 10 minutes, just do that. And then I will do a brief presentation, which will be on Day-Lewis and what we do for about 15 to 20 minutes. And after that, I have about half an hour to ask members of our panel what they do and their perspective as to how they're getting on within the company. And then we will throw this open to you guys, the audience, to ask as many questions as you want. And then hopefully we'll wrap this up at 8:30. So in terms of housekeeping rules, please make sure you mute your video and audio unless you want to ask questions. If you want to leave your video on, that's fine, but please just mute your your audio so that we don't have any interference. If you need to ask a question, please use the chat function in the Zoom at any time. I've got my colleague Jill Melwood, who is actually manning the Zoom chat, so she'll be keeping an eye on that and making notes of any questions that you may want asked. And we will hopefully answer all your questions at the end when we have the open session with the panel members. If you want to ask the question or you want to come on, please feel free during the question and answer session. Just use the hand function in the Zoom taskbar, and then we will let you ask your question. This session is being recorded, so For the benefit of those who couldn't attend, hopefully you'll be able to listen to this later on. And the contact details of all the panel members, including myself, will be available on the slides at the end of the session. So let's do a brief introduction to our panel members. You probably seen their pictures and in the flyers that were sent out, but I'll let them sort of introduce themselves briefly before we go into my presentation. So I'm going to start off with Serish. Serish, do you want to just briefly introduce yourself to the panel members, please?
Yep. Hello, everyone. I'm Serish Chaudhry. I studied pharmacy at Kingston University, and now I'm doing a split placement, 6 months in community, so with Day Lewis, and 6 months at hospital.
Okay, thank you very much. Tarsi?
Hi everyone, my name is Darcy and I went to University of Bath, and I'm currently doing my training year with Day Lewis as a 12-month community placement.
Thank you very much. And Addy?
Hi everyone, I'm Addy. I currently work for I've only worked for Day Lewis, to be honest. I went to uni in Reading. I'm 25, I live in Bristol, and I currently manage a pharmacy for Day Lewis just outside of Bristol.
Okay, thank you very much, guys. And we have my colleague Jill Melwood, who is actually in the background. Jill, do you want to just quickly introduce yourself, please?
Yeah. Oh, hello everyone. Yeah, hello everyone. I'm Jill Melwood, so I'm going to be answering questions in the chat. I've worked for Day Lewis for quite a long time now, but I also now work at the University of Reading as well on the independent prescribing course. So it's always something good to think about afterwards and after you've qualified. So that's all good. But I've worked for Day Lewis for a long time, and I help with the foundation training that Addy runs, and he'll explain a lot more about that in a minute.
Thank you very much. So there we go. So those are the Day Lewis crew, and we're now going to do my presentation. And I'll start off with the journey as a student, all the way to a pharmacist, and then to a trainee pharmacist, and then down to becoming a pharmacist. So obviously, most of you, and that should be all of you really, are actually currently studying pharmacy in your various schools of pharmacy. And so the guiding principles to your course is actually the standards for initial education and training for pharmacists, which is what your schools will be following, and also making sure that they meet the internally learning outcomes as required for any course in pharmacy in the UK. Also, when you get to your final year, hopefully you do your final exams, which is your university assessments, pass your exams, and then you graduate. Having graduated, then you obviously move on to become a trainee pharmacist, which you have to go through oral, which I'll talk briefly about. Again, you guys know a lot about oral anyway, but I'll talk briefly about that. Then when you become a trainee pharmacist, then you would have to do what we call a foundation year. And that's basically, again, following the standards of for initial education and training for pharmacists. It's also about making sure you fulfill all the internal learning outcomes, which you have about 55 of them. And then also using the HEE Trainee Pharmacist Foundation Strategy document, which guides all training programs when you're actually doing your foundation training with Day Lewis or any other employer that you're doing your training with. But the key thing is at the end of that 12 months is for you to do your GPHC assessment, and fingers crossed you will all pass that assessment. And once you pass the assessment, then you go into the process of becoming a registered pharmacist. And then obviously you begin your career as a pharmacist. So what is it that, let's get this out of the way. So what is it that we do as a foundation year? Obviously, for you to be able to do your foundation, you have to go through oral, and I'm sure you guys have been briefed about what you need to do regarding your recruitment through oral. But we do have some students who are not necessarily going through oral, but they go through directly to employers. So what we do is we have facility, and we do take students who don't necessarily go through oral, maybe students who studied abroad and are doing their OSPAP. So they will come through us directly, and we would employ them. but most of you will probably go through Oriel anyway. And obviously we do employ and urge you to use Day Lewis if you want to be in community as your first preference, so that you can actually have the first choice for your foundation training. At Day Lewis, we actually have a variety of split placements and the 12 months. So you have your 12 months that we normally will, that's the typical foundation training. But what we do have, and increasingly we're having now, is what we call the split placements, where you can do a split placement with hospital for 6 months, and you can do it with the community with us for 6 months. You can also do a GP practice for 6 months and Day Lewis for 6 months. Or if you want, you can also do community pharmacy, which is Day Lewis again with pharmaceutical industry. And currently we have collaboration with GSK, and we also have with Reckitt Benckiser. And so we're hoping that there might be other companies coming on board. And this particular split placement seems to be quite popular because we do have a lot of interest from students who want to have an experience of what goes on in the industry, and at the same time, what goes on with in community pharmacy in Day Lewis. Your foundation year in Day Lewis was split into two. You will have the experiential learning, which is what you will be doing, what we call on-the-job learning in the pharmacy, which is really important in terms of application of your knowledge. And that would help you immensely when you're doing your foundation, when you're doing your GPHC assessment. And then you also have the foundation training year program, which is actually the monthly training sessions that you do. And I'm the one actually that leads that for Day Lewis. And you have these monthly training sessions, which is to go through a lot of the clinical topic areas, the high weighting, the medium weighting, and the low weighting as required by GPHC. We cover all of those during the foundation training year with our program. So when we talk of on-the-job learning, what actually is the aim? And the aim is actually, as stated on this slide, is actually to make sure you receive appropriate experience and to demonstrate attributes expected of a qualified pharmacist. So yes, we want you to pass your GPHC assessment and become a registered pharmacist, but it doesn't stop there. What we also are wanting is to make sure you have that experience and you can demonstrate it, that you're as a qualified, when you become a qualified pharmacist. So we want to make sure that you meet all the requirements of the GPHC interim learning outcomes, and we have a lot of documents and strategy to help you with that. And in order for you to meet those experiential learning, or what we call on-the-job learning, is actually to be able to develop your clinical knowledge and safe practice, improve your communication skills, things like the professional, legal, and ethical reasonings. So there's a whole load of things that you would actually develop as you go along, even communicating with healthcare professionals, building relationships, developing your leadership skills and management skills, which is really important, because once you become a trainee pharmacist, you will have pharmacy students who are coming along on clinical placements. You as a trainee, we expect you to show leadership and guide them when they come for these placements. So those are sort of things that we all encourage when you're doing your experiential learning. But most importantly, and more crucially, and our panel members are going to talk briefly about this, is actually developing your expertise at providing community pharmacy services. Some of the services you may not be able to do because you're still trainees, but you can shadow the supervisor or the pharmacist who would help you and guide you and show you what to do. But what you can do, and which our panel members will talk about, is you can actually do things like flu vaccinations. And we're quite excited because we are piloting a project in Day Lewis at the moment where we have our trainees who are doing vaccinations, flu vaccinations. And we can get one of our panel members who's going to talk briefly about that. But those, as stated on this slide, are some of the services that are being provided. There are many more, but these are just a few that, as when you qualify as pharmacists, you would be expected to do. So as you can see now, we're moving away from just dispensing, but we're moving close to doing pharmacy services. So what about the foundation training program? Well, what is that all about? So Day Lewis as a company has a very good reputation for delivering a good pharmacy training program. And that means your monthly training sessions, as I initially said, you'll be split into two groups. and you would have you would come to our conference center in Croydon, which is in London, where you would have your monthly training, a one-day training, and you would go through a particular topic each month, clinical topic area each month, and we would actually make sure you work with your peers and support you in your learning during that time. Our supervisors are all trained, so they would be fully conversant with what to do and how to support you way before you arrive, and even during your training. We do have extra training sessions apart from the monthly training sessions that we organize with hospital pharmacy experts, and also in collaboration with University College London, UCL. These are collaborations that we do where they cover certain topic areas, especially the high weighting areas, and they would actually, people have previous trainings have found these 3 days extra training quite useful. As a part of the program, we use we're encouraged to use the HE assessment strategy document. You'll know more about these documents and tools when you begin your foundation training. And there's also an HE e-portfolio, which all trainees will be signed up to. And you can use that to collate your interim learning outcomes and to track your progress using this e-portfolio, which you can carry along with you even when you finish your foundation training. As I said, the monthly test, we have a clinical and we have calculations, and you do this every month, and we use this to track your progress and see where you are struggling, especially with calculations. If there's any area where you're struggling, we would actually help you and support you to make sure you have the support that is required. The other thing that we also do is we organize mock exams. So every year we'll have mock exams, which is a reflection of the GPHC exams. But apart from the mock exams that we organize, we also have a half mock exam that we will also do to make sure we prepare you for the exams. And we provide a peer support, make sure you're learning from each other, put you into groups, and just support each other as you go along. And I would also be doing a one-to-one support of all trainees, just to make sure your training is progressing well and give you all the necessary support as a company. So it's quite a nice experience, and I don't think there's any other company out there that actually would provide detailed support as we do. So it's just something that you may just want to reflect on. So what happens then after you've finished your foundation training, you've qualified, you've done your GPHC assessments, and as I said, fingers crossed, all of you would actually have passed. What then happens after that? Do we just let you go? No, what we actually do is we encourage you to sign up to Day Lewis to become a pharmacist with us, and we will support you for the first 3 years. We would actually sign you up to our Day Lewis newly qualified pharmacist program. And this program is literally there to support you for the first 3 years of your after qualification. And what that means is, I've got another colleague who will be coming on at the next webinar, who will be talking a lot more about what they do to support newly qualified pharmacists. And again, Adi, who is one of the panel members today, is actually on that program also. So the support is there on a quarterly basis. So you come to the support office, to our conference center, where you would actually go through a day's training with particular topics. It could be either management, it could be on well-being and resilience, leadership, clinical skills, professional content, the ethical dilemmas, whatever it is, anything that would be available to you to support you as a newly qualified pharmacist. We tend to employ more than half of our trainees, and it's a nice way of you just continuing with your foundation training. Once you finish that, it's a good way to just seamlessly move into working as a pharmacist. So initially, when you start working as a pharmacist in Day Lewis, you will probably be a relief pharmacist. And that's a nice way to sort of ease you in to the role of a pharmacist. So you literally be going around to different stores within a certain area where you can actually just cover the regular pharmacist there. And that will build your confidence and help you to navigate all the new things that may be of a bit of a challenge to you. And then once you gain the confidence and you're quite skilled in your profession and in your career, If there's an opening in any of our stores to become a manager, we will then put that offer to you, and the regional manager would have an interview, have a chat with you, and if it fits with what you intend to do, then you actually become a manager. Again, one of our panel members, Adi, fits into that profile where he's now a manager of our store, just 2 years after qualification, which is excellent. So that's just in a nutshell what we do as Day Lewis. There's much more in terms of the programs that we run, but I don't want to bore you too much with that. What I really wanted to do is get into the questions we're going to ask our panels. So what I'm going to do now is ask our panel members some questions, and they would answer those questions. And if you have any questions, you can either put them in the chat or you can come on and ask some of those questions. Okay, so I'm just going to start off by asking Tassi if Tassi, she's there? Yes, she's there. Excellent. So Tassi, how are you? You okay?
Yeah, I'm good, thank you.
Excellent. Thank you once again for coming to this webinar and sharing your experience with our colleagues here. Can I just ask you, how have you managed the changes from being a pharmacy student to a foundation trainee pharmacist? How has that helped, and what has the Day Lewis program done to help you in that transition?
So I think one of the things you realize as becoming a trainee pharmacist is that when you're a student, you tend to feel like as if you're supported a lot by your teachers, practitioners, and you feel like as if everything you do is kind of like you're covered and like being more in a safe zone. Whereas when you become a trainee pharmacist, you're actually in a working world, doing things more hands-on and just being a working member at the end of the day. So it's really about how you balance doing your work and also just training to become a pharmacist, in the sense that you'll realize that there's a lot of things you might not know what to do, and you may find it overwhelming, and the things you just need to do is kind of sometimes just step back and just ask team members like what they're doing, and have them kind of talk through what they do, and sometimes that's a good way to learn. And you may also feel as if you may feel like you have your learning outcomes that you want to meet, and you might start planning things to get on with your training, and actually in the real working world it's not easy to have a certain plan to be met every single time. So then you might feel like as if you're on your own. But the way in which the Day Lewis training program has helped is because every month when we have those training sessions, as you mentioned, Adi, we always have these kind of talks where what to do in certain scenarios, or like, especially I remember from the induction talk that we had about what to kind of expect when you go in, which really actually helped me when I started off, because it helps you realize what you're kind of going into and help you kind of step out of being a student.
So thank you very much. So so just taking on from there, what I would probably want to ask is, because our audience are probably they're all pharmacy students, and they're probably looking at maybe in a few years' time they too are going to be doing this transition. What tips would you give to our audience in terms of going through these changes in terms of the transition? What if you're to give them about 3 tips that they could remember, what would that be?
One thing I would say is be curious. So there's going to be different things that will come up every day when you're working. So and it's probably something that you've never seen before or not know what to do. So always feel confident, and always feel like you have to kind of step out of the comfort zone and ask what you're doing and put yourself out there, because you're being supervised. So even though you're on your own, your supervisor will be there to help you. The other thing is plan your way through. Something like this year is really important that you pace yourself, and planning is really important, and also being honest and asking for help is also another thing that I would suggest as well, because sometimes it could be a lot for you as a trainee pharmacist, because you feel as if, you know, that you need to study for an exam and having to collect some evidences to meet up your learning outcomes. So when you have worries like that, it's really important you have your discussions with your supervisor, because they're really there to help you. So that's my suggestion, I guess, is just being honest and open when you feel like as if it's overwhelming, because by being honest, you can really get it planned in a way that would help you, because at the end of the day, you're your own person. And never compare yourself to another trainee pharmacist as well, because I feel as though another trainee pharmacist may be like collecting way more evidences than you, but for you, that's probably how you learn, and that's absolutely fine. So just take it as you go, but always like ask for help when you need it, basically.
Yeah, thank you. That's some really nice advice there. And I like the idea that, you know, don't look at anybody else, but just focus on what you're doing, because I suppose we all learn differently, don't we? And it's really important. And I think another thing I could as a foundation training manager over the years that I probably have found is just being organized, really, and how to manage your time. I think that's also really important. But thank you very much for that. We'll probably come back to that again in the next few questions and answer sessions again. So I'm going to move on to Serish now, who is Serish there? The slides that I can't see the screen there. I'm assuming she's definitely there, because the way it's lined up here, I can't actually normally see her. Yeah, okay, I can see you now. And Rupert's with us now. So thank you, Rupert, for being with us. So, Serish, I'm just going to ask you a question. You are also a trainee pharmacist, right? And you're enjoying your time with us. Of course, I'm going to say that. But what I just wanted to ask is, could you tell me, or tell us actually, how you've managed, tell us about your experience from a pharmacy student to a trainee pharmacist doing flu vaccinations, and how has the Deluxe program actually helped you to achieve this? And I'm actually going to be a bit forward, if you could please permit me, because I know you're going to be a bit modest here, but I could just say that Serish here has actually delivered 385 flu vaccinations. That's the amount she's delivered up till the month ending October. So I'm just really, really chuffed. And I just want you to please just tell us what that means to you and how you've managed that and how the program has actually helped you.
So starting off with the training for the flu vaccination, I feel like that really helped build my confidence. So because there were so many steps that you had to complete to become a vaccinator, that really helped me become confident. So starting from the CPPE modules that we had to complete, so learning about the vaccination itself, so I'm aware what I'm giving to the patient and I'm able to answer the questions that they would have. That put me at ease. Another thing is I'm not scared of vaccinations like needles. So I guess that's a big factor that helped me. And I've seen quite a few COVID jabs being given, because I used to work in a pharmacy before joining pre-reg. So from that, I knew sort of thing that is, you know, expected, and the questions that you would do, the regulations, you know, social distancing in COVID, the intermuscular technique. So I had an idea of that. Also for Day Lewis, the ECG training session that we had, that was quite useful. It was quite easy to understand, and yeah, it really helped with the overall, and even the SOPs. I feel like reading them helped me get my head around the whole concept of flu jabs. And of course, my supervisor, she's such a sweetheart. She made sure that I was confident enough to do them on my own. And once I was just going. Yeah.
Excellent. And when just taking on that, so what would you say was the benefits to the patients that you were giving these flu vaccinations to, and what were the benefits to your own journey of becoming a qualified pharmacist, of you doing flu vaccinations?
The first very obvious benefit is protecting them from, you know, the flu. But apart from that, I feel like it allows the patient to have that one-to-one communication in like a, you know, cozy consultation room where they can actually talk to you rather than just coming, collecting the prescription and going. You're able to give the patient that time and answer their questions. And from that, I feel like it really helps build that, the rapport and the relationship with your patients, even the regular patients and the ones that don't come to the pharmacy regularly. Quite a few of the ones that I vaccinated, they nominated Day Lewis as as their pharmacy because they really liked how things were running. So from that, I'm really proud of that. Because when they come back, they're like, oh yeah, you vaccinated me, and that's why I'm back. I was like, oh, thank you. Like it just makes you feel good, if that makes sense. Yeah, I think that's the main thing. Like it builds that relationship for the patient, so they feel more comfortable talking about their situation. For myself, it helped build my confidence 100%. And just as a professional, I feel like a professional now compared to before. If you take it back 3 months when I was a student, it was just, book knowledge that you're trying to understand. Just it's all book based, not practical. But now I feel more of a professional. And yeah. So
excellent. That's really good. Thank you so much for that. And I'm just going to ask a further question on that because I'm really curious about this. Could you think back to when you first gave your first flu vaccination to a patient? If you could just think back to that and just tell us and tell the audience what you had to do, how you process it, because now you're giving it out for real and you're giving it to a patient and you really want to make sure that you don't get it wrong. What was that like? And how can you help our audience to overcome any barriers at that point in time?
I think first thing would be confident and believe in yourself. Even if you're nervous, just be confident. Like try to be confident. I feel like you can do it. I was very nervous, but I tried to tell myself, Serge, you're not nervous, you've seen it, you can do this. And yeah, just follow the procedures, know what you have to say. I had like an order in my head at the start, the first vaccination I ever did. I was, practicing in my head, okay, I need to do this, I need to ask this, I need to ask this. And yeah, as you start talking, it will just come naturally. Even with the vaccination, take your time, don't panic. And yeah, and if you're not confident enough, maybe see more supervised vaccinations, or watch your supervisor do them, understand the process, and yeah, do one and take a break. Do what is suitable for you.
Excellent. Thank you so much. And I probably will come back to that again if we have time. So thank you very much for sharing your experience about that, and keep that good work up. So my next question is going to go to Adi, and Adi is an experienced pharmacist who's been through the Day Lewis program. And Adi, I just wanted to, I know you've done so many things in a very short period of time, which is really great. And it's credit to Day Lewis and myself, of course, because I was a foundation training manager. So, but could you tell us how you have developed from a trainee pharmacist who has gone through the Day Lewis Foundation training program to becoming a manager? Because that's a pretty fast, I'll call a fast lane from a trainee to a manager, because what you have in the past is probably a trainee would actually become a manager and become a pharmacist, and then they will go through a period of working as a relief. But you seem to have gone all the way and already are a manager and doing so many wonderful things. Could you just talk through your journey for us, please?
Yeah, of course. I just think it's crazy that you call me an experienced pharmacist when I still feel like a baby, but yeah, I guess that's where I am now. I mean, so like I said earlier, I did my degree with the University of Reading, and I was really lucky in how I actually got offered this position. I feel like it's all progressed very organically. So my pre-reg, my foundation year, Caroline Parkhurst was actually a lecturer at my uni. So she approached me. She said, do you fancy working for Day Lewis? And I thought, well, do they have one in my hometown? And she said, yes, they do. And I thought, okay, yeah, I'll do it. And then now it's kind of crazy looking at it because Rupa's actually in this call. She was there when I got offered my position by her and Tim. They literally said, would you want to stay on with the company? Would you want to move somewhere potentially to work for Day Lewis? And I said, well, my girlfriend lives in Bristol. Is there any chance I could work there? And then they literally made a phone call and said, yeah, if you want it, it's there. So they offered me a position as a relief. So with the sort of timeline you said of a pharmacist, I have done my time as a relief. I did it for a year actually before I started being a manager. So yeah, I moved to Bristol. I was a relief for a year. About halfway through that year, was when I got offered a position of working in a COVID vaccination site as well. One of the regional pharmacist managers kind of wanted to take a step back from it all because she had so many other responsibilities. So she asked if I wanted to do it. And if I'll be honest, the answer was no. I thought she was crazy. I thought there's no way I've got enough experience to do all this, but she kind of talked me into it. And it definitely is something that I really enjoyed doing looking back now. And then, yeah, a few months on from that, that's when Rosie, the regional manager, said, would you want to be a manager at Salford? Because we've got a vacancy there. And I thought, yeah, that's great. I'd only done one shift there, but it was probably one of the nicer shifts I've done. It went really smoothly. I thought it was a really nice pharmacy in a really nice, quaint town full of lovely patients. So I thought, yeah, of course, I really, really was excited to do it. So it all went organically, really, where I started doing my foundation year because my lecturer spotted me and offered me the position. And then in that foundation year, again, Rupa spotted me and said, hey, we're not going to let go of you, stay with us. And then through that, just going out there and hopefully doing a good job, it's led me to being spotted by more people. And then even now as a pharmacist manager, that isn't all I do. So Shreya asked me to help with the foundation pharmacist program because I'd done it for a year. So she asked me to help with a new cohort. I've been working with the social media team and marketing team a bit more. And even recently, I had to do a webinar with a colleague of mine, Yasir, who runs a page called Micropharm. And we did a webinar together and he really liked my teaching style. So he said, how would you like to be a clinical educator for me? So I'm doing online lecturing now as well. So everything is kind of one thing is fed into another thing. So it's all been really organic and it's all been quite challenging, but I've also felt really supported throughout that. You know, some things I thought would be really difficult, but I was really supported and it was really easy. And some things I thought would be really easy and it turns out to be quite challenging. But I definitely can't imagine being in this position today if I'd done it in my time with anyone else than Day Lewis, to be honest.
Excellent. Actually, you've touched on some of the next points. The question I was going to ask is actually what opportunities have arisen. And if I do remember correctly, I think last year you actually won an award at the Chemists and Druggists award ceremony.
Yeah.
Could you just tell us about those opportunities apart from the award and what have been the challenges? Because I think our audience need to know that sometimes things are not always as rosy, but there are always challenges. But with your tenacity, you've been able to achieve what you have. So you can just talk through those few opportunities and the challenges that you have had to go through.
Yeah, definitely. I mean, that is one of the biggest bits of advice I'd say, you know, where you said you've got to have tenacity. I'd say the skill of being able to be calm under pressure is an absolute must as a pharmacist. I think a lot of it, where I did my foundation year, it was actually a very quiet area. It wasn't a very large pharmacy. It was in a small village, but my foundation year was the year that the pandemic hit, as you can remember, because we went from seeing you once a month to not seeing you at all because we had to postpone the program indefinitely because we couldn't see each other in person anymore. But what that did do is the challenge of having to rise to this new uncertain world and the increased workload and the demands of the patients, it actually really prepared me to work in more busier environments, more stressful environments. So even though I'd only done my foundation year in quite a quiet pharmacy, now I left it feeling like I could work in any pharmacy. And as a relief, you do have certain luxuries. You know, you don't have to deal with the managing side of it as much. You get to have a lot of experience working in different pharmacies, and that is a benefit. You kind of have the opportunity to pick things up as you go. You're not thrown straight into the deep end, but sometimes you do have pharmacies where they're short-staffed and you've got to really show that, you know, you can manage yourself and manage the team as well. And occasionally I would be second pharmacist, which was a really good opportunity because you'd be working with someone who's been doing what you're doing for, you know, almost a decade. So you got someone there to shadow and learn from as well. And I was fortunate enough to work with some really lovely pharmacists who were the manager, and I was covering for them in busy pharmacies, and they took me under their wing and I learned a lot from them. And then that was one of the people, Sally, I was second pharmacist for her for quite a long time, and she was the one who said, you know, I want to take a step back. And it was actually her team who suggested me, because she's one of those people that says, no, if you want something done, like, you've got to do it yourself. She was kind of taking all on board herself, but her team said, you know, why don't we offer it to Addy? And like I said, I thought it was too early in my career to be given a title so senior. It felt like being a clinical lead pharmacist, but yeah, it honestly is the best thing I've ever done. I'm too humble to say it's my award. It was a team award. I'm just the leader of that team. You know, I wish I had it here to show off, but I don't. I had to give it to the team. It's a team award, but certainly we'll be mentioning that for years to come.
It's online anyway. If people
It's
want to see
online.
it,
It's online.
yes,
I am in a
they
photo
can see
holding it, so I guess it's mine. Yeah.
Yes. Thank you so much. And I'm talking about awards and things like that, and your journey, which has been quite interesting. And I'm sure that there are many more pharmacists who've gone through the same thing with Day Lewis. The one thing I definitely can say in Day Lewis is we will give you the opportunity to explore and actually do innovative things, because it's part of what we the ethos of our company. But what I wanted to ask you is, in terms of advice, what would you, because there'll probably be a lot of our audience here who are pharmacy students and looking at you and thinking, gosh, I would like to be where he is at the moment. I'm following his footsteps. What advice would you give those people thinking of following your footsteps? What advice, if you're going to sum that up in probably 3 points, what would that be?
Yeah, I've definitely got a few points I can say. I've probably got a million points I could, but I was just going to definitely agree with what you said. I think in a company like Day Lewis, I have been very fortunate to have been offered many different opportunities. It's, when you think about different pharmacies, obviously the big names come into mind like Boots and Lloyd's, but I think the benefit with a company like Day Lewis that are very sort of, they're family run and it feels like a really tight-knit community, is it doesn't take a lot for you to get noticed when you're doing something good, and then you get offered the opportunities. I think 2 years ago when I started my career, if you told me I'd be here, I would have called you crazy, because I would have thought, no, there's no way I'd be doing all these things. I think one of the biggest things is, and that is the benefit of the foundation program as well that I was enrolled onto. I know I'm shamelessly plugging it, but the benefit of that is, one of the mottos I picked up working at a really busy pharmacy was every day is a school day, because there is absolutely no way you're going to rock up there, even after having passed your pre-reg exam, knowing everything. In fact, I'd say there's a lot more you don't know. So you always need to make sure you're always developing yourself and taking hold of opportunities that you're presented with in order to develop your knowledge. And what Darcy said is correct. You don't want to compare yourself to other people. You want to take your own time to learn things, and just make sure that essentially you're not shying away from opportunities to grow. But that being said, like I said, on the other thing I would say is fake it till you make it, because on day one you're going to rock up and people aren't going to know that you are, a young 20-something pharmacist who literally has rocked up for their first shift or is in their first week. They're going to look at you as the pharmacist/pharmacy manager that is going to help them with their problems. So you can't really come up with any excuses. You just need to pretend to be the person that you are going to be eventually, given enough time, and then you will be in those shoes eventually. So I would say try and act in a manner that instills confidence to your patients that you are competent, and same to your staff as well, because your colleagues need to feel confident that they've got someone competent there leading the team. And the biggest sort of thing I think is the way I approach pharmacy. My colleague Melody, who was a pharmacy technician when I did my pre-reg, said, she told me pharmacies, or especially community pharmacy, it's all just about problem solving, and that is the truth. You can have all this clinical knowledge, but realistically, you just need to look at the challenges the day's presenting you with and how you can solve those problems. So every day I just go in, I make a checklist. I'm like, okay, what's on my agenda today? Okay, 10 things that I need to fix. And I just need to go through the list and cross them off, because it's a really busy job. You need to learn to multitask. I'd say that you're never going to have one opportunity where you're going to have a designated 5 minutes to do something. So you need to lie, cheat, and steal your way to those 5 minutes so you can actually go ahead and do the things you need to do that day. And I'd say a checklist is definitely something I'd recommend, because you are going to forget to do some things. And the biggest thing I'd say to anyone, because obviously there is still that choice of whether you want to go to community, hospital, or even industry, is just to think carefully about where you would be suited the best. For me, I always thought, I had a personality suited towards community pharmacy. I don't doubt that I would have succeeded in hospital or industry, but I just thought that's where my strengths lied. So I think especially community pharmacy, if you're someone who is confident in dealing with patients, a confident speaker, a good communicator, and just a general people person, I think you'll do very well in community pharmacy, on top of having just the clinical knowledge needed to just do the job in general. So yeah, those are the main points I'd say. I'm sure there's other things I could cover, but yeah, we'll stop for the sake of time.
Oh, thank you so much. We're actually doing very well with time. We still got about 10 minutes to go. So that is really nice, and we really appreciate some of the advice and tips that our panel members actually have given. I'm just going to ask a general question to the three of you, and this is, again, I'm trying to get our audience to be able to relate to you and what they need to do once they've watched this webinar, and how they can develop themselves to be able to become a competent pharmacist in general, but in particular a community pharmacist. And the question is what are the qualities that you have developed since joining the Day-Lewis program? So if you look at when you started as a trainee pharmacist, from a pharmacy student, and then you started as a trainee pharmacist, and you look at and you look backwards and think, what do you think are the qualities that you have gained by virtue of the fact that you're now with the program, and how that program has actually helped bring out those qualities in you that you know that you now possess that you didn't actually think you have? So I'll throw that question first to Tazi.
I think one of the main things I feel like I've learned was being flexible and being able to prioritize. I think that's something I've learned so far in my training, because when I was a student at university, I'm the kind of person who would have like a fixed revision plan and sticking to that revision plan, because you're kind of able to predict what your university timetable would be like, and being able to come home and do revision and being prepared to do the exam kind of thing. Whereas in a working world, it's like, if you were to transfer those skills, you need to be ready to be flexible in terms of how you plan your day-to-day activities, and sometimes you just need to move things around and be able to prepare yourself, and not feel disheartened as well, because you're still going to get the work done. It's just how you do it, and sometimes you just need to be able to be flexible, and that's one of the key things I feel like I've learned from being a trainee pharmacist so far. And that's something that you probably would have to take on when you're being a pharmacist as well, because not every day is going to be the same, so just being able to balance things out.
Okay, thank you very much. That the same question goes to Sarish.
I think being proactive. So I think that's what I'm doing now, helping out your supervisor, your pharmacist as much as you can, because that's where you pick up the skills, I believe. The pharmacy that I work in is quite busy, so just keeping it going, help out as much as you can with the things you can do, and yeah, just make sure that you're up to date as well with the guidelines, because they do tend to change. Yeah, and balancing your actual revision with the work life. The best thing that you can do is learning at your workplace. So when I'm dispensing or putting delivery away, in my head I try to, I'm not going to say I always do, but I do try to revise the drug that I'm putting away, like amlodipine, like what is that used for, okay, the common side effect. Even with the new medicine service, just keep that revision going where you can. And yeah, I feel like that just helps.
Thank you very much. That's some really useful advice there. And lastly, Adi.
Yeah, I think Farsi and Sarish had some really good points on advice in regards to transitioning and ending up in the position we are in today. I think one of the points you talked on in your question was, how has Day-Lewis helped you develop the skills you've got today? How has working for Day-Lewis actually sort of developed me? And I think one of the biggest things with Day-Lewis and being a relief was adaptability. I'd say that's one big thing that you need to make sure you have. Every day is different. Even if you are in the same pharmacy every day, you need to be able to deal with whatever's thrown you in your direction. I think as pharmacy, we are often either the first point of contact or the last point of contact with the patient, because we're the most approachable. Or on the other hand, we are going to be the last person before the patient goes away and takes their medication. So you need to be able to deal with anything, especially in a day and age like now where, with GP practices so overwhelmed, we're going to get a lot more people coming through our door. So I think adaptability is a quality I already had, but Day-Lewis really pushed it to, prove to myself that I am adaptable and I can deal with any situation. I think one thing I wouldn't have said that I was good at, and even now I probably wouldn't say I am, but that's probably more humility rather than anything, is being able to lead a team. I definitely wouldn't have put myself up to manage a team, because I wouldn't have thought that that's something I would have wanted to do or been good at. But Day Lewis offer you the opportunity because they believe you can do it. And I think that's given me a lot of self-belief now. And like looking back and having been a manager for a year now, it shows to me that I can do it. And I think one of the biggest things working for Day Lewis has given me is kind of a sense of pride, and also like the duty to uphold the good name of the company. When I think about Day Lewis, I think that it has a good reputation. So when I go in every day, I want to make sure I uphold that reputation. I feel very disappointed when I let a patient down for something, or equally on the opposite side, if a patient has a really good experience or says something really kind, I think to myself that it's good, because not only do they think better of me and my team, but the company Day Lewis is getting promoted. And it's just really nice to get thank you cards, and I'm looking forward to all the biscuits and chocolates that we're going to get shoved in our faces this Christmas. It's just nice to be able to work with a brand that has such a sort of high status. I've not heard a bad thing said about them ever, and it feels good to be working for that company that you can represent every day and feel proud to, as cheesy as that sounds. But I do feel that way, honestly.
Yeah, that's great. And I think just to reiterate what I'm hearing here from what you guys is and things like adaptability. It's really an important, but flexibility. It's really important to be flexible right from the word go, and actually be proactive. And I like that, actually being proactive, because there's always something to do in pharmacy, in community pharmacy. There's always something to do. People say, "Oh, I don't know what to do," but there's always something to do. And the other thing that Serish has actually highlighted, which is the ability to strike a balance between work and family life, because it's really important also during your foundation training, and even when you qualify as a pharmacist, to make sure you have that balance so that you don't burn out. So I think you guys have actually definitely shared a lot of your experiences. Indeed, I know we can go on and on if we had time, but I think hopefully our audience would have actually listened to what you have to say, and they would actually have the opportunity to ask some questions. But before I move on to the next part of the webinar, which is questions from the audience, we have Rupert. I think, is Rupert still here? Yes, Rupert's here. Yes. Hello. So yes, just thought before we go to the questions from the audience, if you want to say a few things to our audience before we go to them.
I'd love to. Thank you.
Okay.
Yeah, lovely. Thank you. I just want to say thank you and well done to all of our presenters, Serish, Stasi, and Adi. I am incredibly nervous. I don't get nervous speaking to like my entire organization. I'm very nervous speaking to students because you never know what question you're going to be asked. So I'm going to fire all the technical and all the clinical questions over to my very competent team here. I'm Rupert. I'm one of the owners and directors at Day Lewis. I was founded by my father 47 years ago. I'm not a pharmacist. I have zero attention to detail, although I do have good people skills. And I also tend to do everything that I'm told not to do and don't do things I'm told to do. So I spent my whole life not wanting to be a pharmacist. I actually became a dentist. And so, again, not very helpful with zero attention to detail. So I've parked that aside as well. I absolutely love community pharmacy. I can't tell you what that is. I suspect it's one of my very, very first siblings. I've grown up in this industry. I'm incredibly proud of all my teams. I champion our pharmacy teams all the time. And particularly for what you guys do, because I think Sam and I one morning just said, "You're pharmacy heroes." And I think that expression got coined, and we genuinely mean it. Where else in the world can you access world-class healthcare without an appointment and just walk straight in? We'll be talking about things like improving accessibility and reducing health inequalities and making it fair for all. I mean, just community pharmacy says it all. I'm really, really super proud of you, and really glad that so many people have joined the call today to listen to my colleagues as well, who I have not paid, by the way, but I may well send you some vouchers, so thank you for giving up an hour of your evening on a Wednesday after, I'm pretty sure, a very long day. Just a bit about the business. We're at 270 pharmacies, and as I said, we're at the heart of community pharmacy business, but we're not just pharmacy. For me, it's around really the future of pharmacy is bringing in innovation, it's bringing in technology, it's bringing in better systems, it's living in a 22nd century for me, and I'm constantly thinking about how we can improve the lives of our teams and our patients. And as Adi said, you get access to so many different areas as a pharmacist within our company, and I genuinely, my personal goal every day is looking at the future of pharmacy and what it means to be a community pharmacist. And that can be from everything. I mean, just from the flexibility, I know Tarsi mentioned that, to the variety, to the remuneration, even to the point where we're looking at how we can get pharmacists to become joint ventures with us. People actually might want to run their own business, feel like they're in their own business and just don't know where to start. So there's so much we can offer. And so I'm so glad that so many of you enjoyed. And if it's not right for you now as a trainee pharmacist, please do reach out if you ever feel like there's something you want to know more about even in the future. I have a little saying, sort of take a piece of Day Lewis with you. When you've heard someone talk from Day Lewis, certainly from the three speakers and Adi and Jill at the moment too, you never forget Day Lewis. So please do take a piece with you. Always feel free to reach out. I'm on LinkedIn and my email is rupa.patel@daylewisplc.co.uk, and I'm quite happy to put that into the chat. So if any one of you, any one of your colleagues or friends ever want to know more about the company or know more about what we're doing in community pharmacy, please do feel comfortable just to reach out anytime. And thank you, Adi, for facilitating.
That's okay. Thank you very much, Rupert. And as you know, at Day Lewis, we're always at the forefront of innovation. We always come up with various ways and new ways of working. And I'm glad to say that we are part and parcel of, and that's where our flu vaccination program for trainees has actually been really exciting. And we've got quite a few of our trainees who've been delivering some very good numbers of flu vaccinations, and we'll be collating that in the next few months to see how many we're able to do. So now we're going to go to questions from the audience, and please feel free. You can either come on, unmute your video and audio and ask your question. No question is a stupid question or a silly question. Ask any question you want to ask. Or if there's any in the chat. Jill, is there any questions in the chat?
Oh, hi there. Yeah, sorry, I couldn't unmute myself then. We have a few, but not very many at the moment, but I'll ask this one first. The panel has kind of answered it, but I think it might, if we just dig deeper into it, it would be great actually. So the question is, what is the transition like from graduating from university to becoming that trainee pharmacist? So what was that transition like? And then from that trainee pharmacist into being a relief pharmacist. I think you have really touched on this, but one of the things that you guys are talking as a panel, I did think was resilience. And I think you've all built that resilience. And I think that's a really important skill. And I just wanted to highlight that before you answered the question. But if you could, I guess, Suresh, do you want to start?
Yeah, that will be fine.
Yep. So I think the transition is quite smooth, because you know how from A levels to university it could be a slight jump in education, but because what you have learned in uni applies directly to community pharmacy, it is a quite smooth transition, I believe. The one tip that I would give and would highly recommend is having some sort of community experience prior to coming into your pre-reg. So even if it's a summer placement that you're doing or something extra apart from the uni few day placements, even working part-time, which I used to do, has really helped, because luckily the same system, so ProScript, that my previous job used to use is used in my current pharmacy. So I found the transition very smooth. Yeah, because it's like working in my previous pharmacy, because the system is very similar. So I'll recommend that.
Okay. Hazi? Anything to add to that, Chazzy?
Yeah, adding on to what Sho said as well, is that a lot of the skills as well that you develop in university actually helps transition into being a trainee pharmacist as well. So like the teamwork skills, so like getting to know who you're working with, and the planning skills, the communication skills, everything comes into play. So this transition itself is actually quite smooth. And what would actually be challenging is just being able to do like your normal working shift, and then being able to balance studying. And sometimes, as Sho said earlier as well, like studying on the job is probably something that you would come to realize as more effective as well, because a lot of the learning is actually done in person, and you may feel like as if you need to do some revision after, but it's okay to tell yourself that, you know, that it wouldn't, you might not do everything you got planned, but it's just being able to see that. I guess that's all I would have to add.
Yeah, thank you. That's very good. And I could probably just add a few more tips there, because one of the things we do at Delu is when we have our induction, is we go through some of these points actually about what are the things that you need to do to be able to transition. And one of the things I always say is that the first few months of you starting your foundation training, you're always going to struggle, because it's a new team, new place. You need to find out your way to work. Working out how to just settle in. That takes time. Some of your colleagues may settle in pretty quickly, like Sarisha just said, in terms of the system. They know how because they're using PostScript when they were working in the summer job, and now she just literally transitioned. So that bit of the transition is easy. Whereas some people, they've never worked in a community pharmacy, and the transition can be much longer. And I think one of the panel members also did say about focusing, don't focus on what your colleagues are doing, just focusing on your own transition and make sure you follow that. Because some of your colleagues, maybe with another provider or another employer or another store, would say, oh, well, I've been doing X, Y, and Z now. Haven't you started doing that? Or you should be doing that now. It's not about who's doing what. It's about how you phase yourself in. And that sort of tends to help also with the transition. The other question, I think the other part of that, which Jill was part of the question, was the transition from trainee to pharmacist, which I think Adi had actually talked about. But is there any other points, Adi, that you may want to just add for the benefit of the person who asked that question?
No, yeah, there's plenty of points I can add. I was just going to sort of build on the points that Sarish and Darcy said, actually, because when they say it's quite a smooth transition, I'm thinking, God, like, did we do the same program? Because to me, as someone who, there are ways to make it smoother. So where Sarish said she worked in a community pharmacy before, I would encourage people to do that. I would encourage people to get a placement or a part-time job or even a summer placement. But I will also give you some words of encouragement, because I was someone who'd never worked in a pharmacy before and had my pre-reg year basically like ruined halfway through. But I'm still here. You can still succeed. You don't feel pressured. If you can't possibly squeeze in a placement or a part-time job in your life right now, that doesn't mean you're not going to succeed. You can become at least as good as me, in my opinion, which might sound like a high target, but it's really not. You can still succeed just by being and having the qualities you need to have to be a successful pharmacist. The experience comes with the foundation year. I think if the foundation year didn't exist, then yeah, it would be very difficult going from uni straight into full-time work. But the foundation year is there as a buffer to actually pick up the skills you need. I'd say the biggest bit of advice I could give, not just for working as a pharmacist, but also, for these transitions is, and again, I'm full of one-liners, but, failing to prepare is preparing to fail. I remember when I was going to be a relief, like I thought, okay, I need to know where these pharmacies are. I need to make sure I've got the right, I need to know where to park for these places. I need to know that I've got the right kit, a pens and a calculator potentially. I need to make sure I've got a BNF or the BNF app on my phone, like all these little things that you think, well, that's obvious, isn't it? But it is obvious, but that means you still have to do it. I would call up certain pharmacies and just double check if there's anything I needed to know, or, where the best place to park is, because I don't want to be paying for some really expensive car park. Just little things like this where you can make at least getting to work not a concern of yours, and then you can actually worry about your day, because there's going to be so many things that are going to get thrown your way that are going to knock you this way or that way. So you want to make sure your baseline level is as stable as possible. So you want to make sure you're not worrying about external factors in life. You want to make sure you know what you're going to get for lunch. You want to make sure you got a good night's sleep, all these things. And also I'd say transparency is very important. I rocked up on day one working in a pharmacy, and I wasn't a second pharmacist that day. My first day working in a pharmacy was working in the pharmacy of the regional pharmacist manager. So it was someone who, has got quite high esteem and wearing a busy pharmacy. And I just told the ladies I was working with, I said, look, like, it's my first day. That doesn't mean, that you guys need to babysit me, but there are going to be things that I don't know. So just, help me out where I need it. But it went really smoothly. And I did the same thing for a couple of weeks. I went to different places. I was new there. I said, it's only my second or third week. As long as you're transparent with people and they know what to expect, it's absolutely fine. Similarly, like when a patient asks me a question that I don't know the answer to, I tell them, I say, that's a really good question. Can you give me a few minutes? I'll look into it for you. I think being open and being honest and being seen as an honest individual is definitely something that can help you in your career and also help build a good relationship with your staff and your colleagues, your staff and your patients. Yeah.
So thank you very much. Any more questions from the chat, Jill?
Yeah, we've got a couple actually. So I think Rupert's typing an answer at the moment for this one, but I'll throw it to the panel and yourself, Adi, which is it's come from Pam. And so what's the biggest challenge facing community pharmacists in the near future?
Okay, so I'll probably put that to Adi first.
Oh, good question. I'm trying to think now. Well, I suppose one thing that I think it's not the biggest challenge, but I definitely think it's a challenge, is community pharmacy is becoming a lot more service focused. And I think especially with a company like Day Lewis that are trying to, push the envelope forward on what we can do as a pharmacy. I think one of the biggest challenges is going to be, how far can we push it? How qualified are our employees to be providing X, Y, and Z? For example, we've decided, and I agree that foundation pharmacists are capable enough to be vaccinating, because I actually think anyone with a working arm and 20/20 vision can vaccinate, in my opinion. So it's all about taking those leaps and thinking about services we can develop. And also, I think a big challenge for community pharmacy, and I think Rupert might agree, is you do lose patients to online pharmacies, and it's about how to make patients recognize the value in a community pharmacy rather than just signing up to an online pharmacy, getting your medication delivered from there. Because there are things that a community pharmacy brings, a physical pharmacy brings, that just getting your medications dropped off to your house wouldn't. And I think trying to retain your patients and also provide them things that they can't get elsewhere is a very big challenge.
Okay, I think I'm not sure whether actually Sarish and Tazi can actually probably give it a go. And what do you think would be the challenges for community pharmacy in the future?
So adding on from what Ade said, I would say that because of the services and stuff, the pharmacies are getting more busy. So maintaining that relationship with your patients, I feel like, is getting harder, if that makes sense, because you're spending less time with individual patients. So that could be a struggle in the future, because you're focusing on the services and getting things going, because there's a lot more workload on the pharmacist and the staff itself. So that could be a challenge.
Okay, that's a good one actually. And Tazi?
Yeah, I would probably say something similar to what Sarah said as well. I think the time spent to do each workload would become something to think about when you're working in a community pharmacy, because you would want to spend time talking to the patient, but then you also have another patient waiting for a prescription, and maybe like someone phoning for a query or wanting to speak to pharmacists. Just like being able to balance that would become a pressure. That I think that would be a challenge, I guess, for pharmacy.
Yeah, okay, that's a nice one. I think my colleague Jill, I think I would ask you, Jill, also, because you've been a pharmacist for a number of years now, and I would then have my comments, and then probably Rupa can sum up her view from a national perspective.
Yeah, so for me, I think community pharmacists, we're all going to become independent prescribers in the near future, and I think that's really important, and it's really important for the service-led industry in community pharmacy to be able to really expand those services. So things like the hypertension finding service at the moment, which we do in community pharmacy, when people do become independent prescribers, they can really push and expand that service a lot more and make it a lot more accessible to people. So I think that's one of the big major changes. And as you said, Addy, I think dispensing and on the technical side of the pharmacist job, which we've done for quite a lot of years, will become the domain of the technicians, and the community pharmacists will be just really looking at those clinical focused areas, clinically checking prescriptions and focusing on that patient-centered care that we really want to do. So that's where I see it going, and almost becoming, I don't know, a bit more like a mini GP surgery. I think it's at some point being that more service-led, I think.
Yeah, thank you very much. And just to sort of reiterate a few of the points that you've read, when I look back, probably 10, 15, 20 years ago, pharmacy doing flu vaccinations would never have actually happened. And in fact, I remember about 20 years ago, 15 years ago, when GPs heard about pharmacists doing flu vaccinations, they had a fit that how can that be possible? No way, we don't want pharmacists to do that. They are not properly trained, this, that, and the rest. And here we are, now we have trainee pharmacists doing flu vaccinations. So I then say, fast forward another 5, 10 years from now, we'll probably also be in a situation where you walk into a pharmacy and you will be seeing pharmacists doing purely service-led. You'll be seeing probably one or even more pharmacies in a particular store, like a hub, where you have different pharmacies providing different services, or you could have a pharmacy opening longer hours with 2 pharmacies, and you're not actually focusing at all on dispensing, but you're doing services that's properly remunerated by the government. With changes in legislation, it would happen at some point. So I think the future is actually bright for community pharmacy. Yes, we're going through quite a lot of challenges. We're losing pharmacists to GP practices and all the rest. But I think, like many other things will turn around. People go, and then at some point they will come back again. They start drifting back again when they see that there's much more value in actually being in the pharmacy and providing those services. So I think the future is quite bright for pharmacists, and for the audience who are still pharmacy students. I think if you play back this webinar in another 10 years time, you probably be what we're hailing as great services will probably just be the norm that we're doing now. So, and you're probably doing even much more, and technology is going to play a big role in the future of community pharmacy in general. And Rupert, I don't know if you have anything to say from a company-wide perspective.
Oh yeah, thanks, Eddie. I put some stuff into the chat, but from a much zoomed out perspective, it's definitely around ensuring that community pharmacy gets the recognition, the value, and the funding that it deserves from the NHS. I think that, community pharmacists really outdone themselves during the pandemic. I think millions and millions of lives would have been lost had we not had you guys at the forefront. And I, I sometimes think 8 weeks of people sort of clapping at 7 o'clock on a Thursday for our front, that wasn't enough. That was just a little bit. And I think we've got to make sure we continuously bang that drum or saucepan or whatever we're doing on the doorsteps for our frontline colleagues all the time. And so that's pretty much what I do. I was just thinking about, you mentioned about vaccinators. I'm a vaccinator, so really anyone can do it because I did it. I got thrown into the deep end, Zirish. I ended up having to vaccinate over 100 colleagues over the Christmas period because I thought I'd do everything but vaccinate. I was like, I'll be the crowd control. This is COVID vaccinations. I thought I'd do everything else, the farm outcomes. And I got there, and there we go. They had 100 patients waiting for me that day. So I think you talk about being courageous. I was dead scared. So yeah, I think it's just sort of reflect on that. So if I can do it, anyone can do it. Yeah, service orientated is all about how do we beat the online pharmacies. They can't have these face-to-face interactions. They don't know your patient's mother's name, and whether they've got kids, whether they've got whether they live alone, whether they've got mental health issues. There is so much that online pharmacies simply cannot do for our communities. It would be I don't know what the right word is. It would be a sin if the government thought that online pharmacy would be able to do the work that you guys do. It's too simplistic. It really cannot happen, and it's hugely worrying for health impact if that was to happen. So for me, it's around introducing technology to make it better and easier for our pharmacists, and trusted technology. So we have a hub. I know many companies do. We're looking at doing original pack dispensing. So that'll be where we can actually send full packs of the particular prescriptions to pharmacies in a big tote. So it's already picked for you, and you can scan it in. We've got scanners, we've got text to patients. There's a lot that I think we need to involve technology, because that will make it safer, and also makes you guys feel more confident that you can then have that quality time with the patients.
Okay, thank you very much. Is there any other questions, Jill?
Oh yeah, we've got a few actually, a couple.
Okay,
So,
we're gonna quickly get through them.
So yeah, that's what I was thinking. So I'll take this one quickly and I'll send the answer in the chat. So does Daylewis take trainees outside Oriel, which you mentioned in your chat? We do.
Yeah.
And I'm going to put Rochelle and Jane's email into the chat so people can send their CVs and a covering letter to them if they want to do that outside. Just to reiterate though, we don't allocate the branch till Oriel's finished, because we don't know what we get allocated in Oriel. So you can still apply, but you wouldn't know where. Possibly you might know the area, but you can't pinpoint the store until after that has happened. So that's there. So that's that one. And then this is a really nice question. So what is your favorite and least favorite thing about working in community pharmacy?
Okay, so I think I'll put that to the panel members first, and then probably Jill and I could probably wrap that up there too. So Tarsi.
I think the most favorite part of it is I actually enjoy working with my team a lot, because I feel like every day there's always something to learn from everyone, and there's like different members in the team, so you're always learning something different. Also, it's very different every day in the community pharmacy, so there's always something different to do, even though it's quite stereotypical to say that you're doing the same thing every day at community pharmacy, which I kind of think isn't true. The least favorite thing is when you don't expect a patient to just have a go at you. Sometimes it could bring your mood down and stuff, but honestly, you just have to like not take it personally, and you would come to learn that is that you have to think about it in the patient's perspective as well. Like they're actually not well, they're coming in, you know, for medication after waiting at GP surgery for a long time. So it's important that when you have things like that happen, to not take it personally. That's one thing I feel like the least thing, but it's something that you'll get used to.
Yeah, I definitely can second that anyway. So thank you for that. And Serif?
Let's start with my least favorite. I can get that because I don't really know. I guess it would have to be that the busy periods, it's like a burst of busy period, and it's not consistent basically. For me, that might be the least favorite. I'd rather it be consistent than the bursts that we get. But with that, there are lots of, it helps you, work under stressful, busy situations. So it does build on your, personality and as role as a trainee pharmacist. My most favorite would be the services. I feel like helping out my supervisor and my pharmacist with the services really helps me understand all of the extent that a community pharmacy can go to, rather than just giving out prescriptions. Even shadowing her doing certain services, I learn a lot through that. So yeah, I really enjoy the services.
Thank you. And Addy?
Okay, so I want to end on a positive note, so I'll do my least favorite thing first as well, because otherwise I don't want to end on a negative. But I suppose my least favorite thing is just, I suppose the patients don't really, I really dislike it when patients don't understand the fundamentals of how the pharmacy works, and that leads to a lot of confusion and miscommunication. So when a patient thinks we've done something wrong and really we're not the ones to blame, because like I said, we are the final point in that flow chart. Sometimes the patients think it's our fault when really it's a problem that started way higher up, and sadly we are the people who have to deal with it. So a patient's asking why medication's not ready, or why this is out of stock, or why this has happened, or that's happened, or like literally last week a patient left a 1-star review, even though it was not my fault at all that their medication wasn't ready. In fact, I was the one calling the GPs to try and get it sorted before they even came into the pharmacy. But hey ho, it is what it is. I've officially contributed to a 5-star review and a 1-star review, so it averages out really. I've had a decent year so far. So yeah, my least favorite thing is just when patients don't understand, the role we have and also the part we have to play in creating problems, which is basically none, and the part we have in solving problems, which is basically 100%, in my opinion. But my favorite thing is definitely, and this is something that I sort of struggled to appreciate before, but now I really have done, was when patients are actually very grateful to you. Like before, I felt like I did things just because it was my job. I would go out of the way for patients just because it was my duty to, but I've started to enjoy doing it a lot more. It really means a lot to me when a patient is grateful and when they really recognize that you've helped them out. I don't do it for this. I don't expect gratitude at every single interaction, but when a patient goes out of their way to thank you, or, I've had several cards throughout the year where patients have been very, very grateful. Or even literally yesterday, I was doing a lady's flu jab and we'd finished up and she asked me if I was the pharmacist around January, February. And I said, yes, I was. And she said, okay, because I think it's you who I spoke to because I had this problem and the GPs were being entirely unhelpful and I couldn't get advice anywhere. And you were the only person I could speak to, and you gave me really good advice, and you seemed like the only person who cared. And then that led me, you sort of convinced me to go to the GPs, and now I'm getting treatment for X, Y, and Z. And I just thought there was no reason for her to say that to me, but I was so grateful to her. So I think when patients recognize, I'm not saying when patients are as grateful as they should be, but when a patient is actually appreciative of the effort you put in, because I try and go out of my way for any patient. I don't care if they're nice to me or not, but when the nice ones are nice back to you, it really makes your day. And that lady, what she said that to me at 10 o'clock yesterday. And I thought, well, my day's been made already. It can be ruined at any point, but it was already made at 10 o'clock.
Okay, excellent. Thank you very much. And I suppose Jill and I, we just echo most of what you guys have said. And that's really that. Is there any other questions?
There is one, and actually, Eddie, I think Eddie just answered it. Really, it says, "Do you remember a time when you made a positive impact to a patient's life as a trainee pharmacist?"
Oh yeah, okay.
So I think that's kind of, we have really answered that. But in terms of what I enjoy most about community and pharmacy is the sense of the community, and I think that's really, really important, and the sense of the community that we bring to that small community, because like high streets, etc., they're not what they used to be, and you have that sense of community in that in community pharmacy, and I think that's really important, and it can be lost, and I think that's what Daylewis does really well in all our towns and high streets, definitely.
Yeah, and you're actually right, because I mean, one of the things I actually look forward to when I used to be in store is actually Christmas, towards the Christmas, because we got loads of biscuits, loads of quality sweets, loads of cakes. It's just amazing. I just got bags and bags of them. I really love those periods because patients really appreciate. They didn't have to do it, but they come back with cards and thanks. So is there any other questions, Jill, before we move on?
No, that was the last one. I don't know. Okay. No one else has put anything else in there. So
okay. I'll just ask just before we move on, is there anybody in the audience who may want to come on and just ask any questions?
I did have one thing I wanted to add quickly, if possible.
Yes.
Because I know obviously Rupa is here and she is, the top of the company basically. And I think it's very easy. I know for myself, I think it's very easy when you've got someone who, runs/owns the business coming on and saying all these good things about it, to think, like, of course she's going to say that. Of course she's going to say that Daylewis are great and they're like at the forefront of pharmacy and they're doing all these cutting edge things. But as someone who is just an employee for them, not just an employee, but as someone who works for them, like, I just want to reiterate that, like, she is being honest. Like, I do feel like a lot of the things she says does actually materialize into real life, like especially things about pushing services, things about how, you get the support you need, because there's so many friends I have throughout the pharmacy, and if I need support, I can access it really easily. Thankfully, I don't have to bother anyone all day, every day, but you get so many people that you can just count on to message and they can give you advice. And even things like the technological side of it. Like, I remember when scanning prescriptions to send text messages to patients, I thought, wow, this is crazy. This is so good. And all the patients were blown away by it. But we've recently had a kiosk installed in our pharmacy. And I know a lot of my colleagues were thinking, like, why are they doing that? If it ain't broke, don't fix it. But actually, it's been up and running for a few weeks, and the patients absolutely love it. It's a 24-hour collection point, and I just think things like this, where you know, they show you that they're willing to invest in your pharmacy and they're willing to take steps towards improving yours and the patient's experience. Like, I can definitely vouch that Rupert is not just doing this behind her back and lying. She's definitely, you know, she's backing up her, she's putting her
Probably not,
where her mouth
Addy.
is.
There's probably a lot of many other things I would do for an easier life. I really honestly love what you guys do, and I love Day Lewis. So no, I can't sugarcoat it any better than that.
Okay, thank you very much. And so just moving on, because I'm conscious of time, just for the benefit of our audience, should in case you want to reach out to any of us, I know Rupa's she said you put her details in the chat. But if you maybe want to take a screenshot of this, or when you're listening to this or watching this webinar again, if you want to reach out to any one of us, please feel free to send us an email. And what I would just like to do also is a reminder that we're having another webinar on the 14th of December. And this is where we have another 3 colleagues from Day Lewis who are experienced pharmacists, who would now look at the perspective of career opportunities within Day Lewis, what they've been able to achieve, having worked in Day Lewis and still working in Day Lewis, and the different things that they can do. So again, please spread the news. And again, we would like to have you all back here on the 14th of December to have another webinar session where you can ask loads of questions, spread the news to your colleagues. And yeah, that really would be it from me. Emma, are you there? Oh, Emma's got a question.
Yeah, hi.
Hello,
Yeah,
Emma.
I just wanted to say a massive thank you. I personally, as a training pharmacist, I found that webinar very useful, and I'm sure all the students did as well. And I want to thank all the panelists for their time, Ade, you, and Rupa, and everyone for attending as well. Yeah, it's been very useful to know all that, because as you say in the beginning, it's quite good to have someone that's in there and someone that's going through community pharmacy work on a daily basis. So yeah, it's been very useful. And just a couple of things. We're gonna pop a webinar link for the feedback form if attendees can please fill it out. And as Adam mentioned, we've got another webinar, Day Lewis running on the 14th. So please come to that as well. I'm sure you won't disappoint. It'll be as good, if not better, than the one tonight. And we also have our area conferences coming up this month. So yeah, just stay tuned on social media for those as well. Thank you.
Thank you very much. And could you, once you've audited the webinar, the recordings, if you don't mind, if you could maybe send us the link so that we could also spread that within the company also for the benefit of everybody within Day Lewis. So once again, thank you very much to Adi. Thank you very much to Jill. Thank you very much to Rupa, Tasi, and Serish. You've been wonderful, and we're really grateful for you to come along. So have a good evening, and bye-bye.
Thank you, had a great time.
you.
Thanks a lot. Take care, everyone.
Bye.
Bye.
So I'll stop sharing. Okay, so bye-bye.